Enrollment Specialist at the Family Health Clinic. For our 25th anniversary, we're interviewing staff and community members to explore what the Family Health Clinic means to them. In this video, we are interviewing John Wilson. John Wilson, why don't you introduce yourself?
Okay. I'm John Wilson. I'm a patient of the clinic, and I'm also a board member on the clinic. I've been a patient for about 13 years, and I've been on the board for over 10 years. And it's a great organization that really does a lot for our town and our county, and what we can do for all counties and all clinics as a new system.
Awesome. How have you seen the Family Health Clinic grow in the community since you first became a patient, or when you first got involved with the clinic?
Well, I was having trouble moving here from out west, finding a physician or an organization that was as professional as the one that I left. And that took some doing until I found the family clinics, of which there were two at the time, one in Delphi and one in Monon. And they were in storefronts, and they were there to provide location for anybody who had trouble traveling and who had trouble paying if they were not fully insured. And I had COBRA, and I couldn't find a doctor that actually took my insurance. And that's how I got involved at the beginning. And it's been a great improvement in my healthcare, because what I thought was wrong with me wasn't, and they were the ones to find out what really would help me the most, and took it as you're a new person on a slate, and not just by what my previous physicians had said I needed. So I have nothing but great things to say about the organization, and that it's expanded so much and is doing a great thing for our society and for our country.
What are some ways that you have seen the Family Health Clinic impact our community?
Well, having something that's location that you can get to in less than a half hour, and an organization that would take insurance or sliding scale, did a lot for people who were in between jobs and didn't have their insurance, or did, and it was difficult to find a physician that would take that insurance. So this group, being part of Purdue, has many good things at their disposal. And for our community, we needed something in healthcare. Every town and every county needs to have a part of their society healthcare, and they've done a great job of bringing it to our community, and going forward as we're in the pandemic that we're in, which is ideally what the government wanted in setting up this as a business, and ran like a business with board members and people who are part of the users, so that if there's something that we're not getting the proper feedback, we're going to get it from our board members who are part of our society.
What does being part of the Family Health Clinic mean to you?
It means that I'm giving back to the community that has been so gracious to me. And if I've been very fortunate to find out what the problem was and what it wasn't that I didn't know, and then wanting to give back to the community by the feedback that being on the board is.
What is one thing you want the community to know about the Family Health Clinic?
That they're getting state-of-the-art, cutting-edge medical attention, and at the same point in time, they are helping in training the next generation of medical providers with, again, cutting edge or state-of-the-art information. You don't get that everywhere, and they're coming out of classrooms ready to go in our society, and we need that ready to go that Purdue puts together with the School of Nursing. And we need to do it at a better cost than what a physician model, the nurse practitioner model that Purdue has set up and was part of this right from the beginning, has made it possible for us to get a handle on the cost of medical care while still having access points that you can get to in a short period of time, so that we keep people healthy and we keep people working. And that's what the cost effectiveness of the family health clinics are doing part in our society. They have just an intricate part of filling in the position before you go to some specialist. And the model for a nurse practitioner is considerably less than a regular doctor. And at the same time, we want to be within a half hour of anybody who needs healthcare.
John Wilson, thank you so much for your time and for your involvement with the Family Health Clinic.
Well, thank you, Antionette. You're a great part of our society here, and you're fitting into our community so well. I want to make sure that you always know that your place is really needed, and we hope that you'll be part of the community for a long, long time.
Thank you.